Are kids getting sicker from the Delta variant? How concerned do we need to be with Delta in kids?
It's difficult to say if kids are truly getting sicker with Delta variant, but it does seem that kids are becoming infected more commonly now. Kids do sort of make up a sort of larger proportion of new cases than they did earlier, but this is also kind of tempered by the fact that kids are far less likely to be vaccinated since the vaccine's only approved for ages 12 and above, and there's a large chunk of kids that are under the age of 12. So I think there's more to come for that, but we are sort of seeing more cases in children as the days go on.
Should vaccinated parents of unvaccinated kids lock down again? Like, is that where we're at?
It really reflects upon how much risk you feel is acceptable to sort of balance out the obvious need for sort of social interaction, things like that. I mean, kids do need that. There have certainly been a lot of sort of harmful effects of lockdown on children in the last year. But what I would say is that, nothing has significantly changed for unvaccinated children in terms of how susceptible they are to COVID now than a year ago. And they may be a little bit more susceptible since we are seeing cases increase a little bit more quickly in children now because of the Delta variant. So I think that it would be a good idea personally to sort of maybe not completely lock down, but certainly sort of pick a sort of social circle of a relatively smallish social circle that sort of you have your children sort of interact with, and try to sort of minimize activities in sort of large crowded settings. I think that's sort of the best compromise we can sort of give for them.
Tell us about being outdoors with kids right now. So a couple things, like, can unvaccinated kids play outdoors together safely right now? And same kind of thing, like, how risky is it to take unvaccinated kids to an event like the state fair that's mostly outdoors, but you're with kind of a crowd?
The reason why recommendations are different outdoors than indoors is that when you're outdoors, there's much more air around, there's wind blowing, there's much better sort of ventilation. So if someone has COVID and is coughing, it's going to be spread out very quickly, and your exposure is going to be shorter and likely less. So in general, it's better to be outdoors than indoors. If your children are playing outdoors with other unvaccinated children, there is going to be some risk, especially if one of them is infected, especially if they're really close together, and they get coughed on, or they're wrestling or something like that. So there is always going to be some risk. So what I would, and sort of similarly for a state fair, is that it's good that you have better ventilation, but if you're around a lot of people in close proximity for a long time, it's going to raise your risk as well. So I think it's really one of those things where the likelihood of you getting COVID transmission between unvaccinated people is sort of based on a variety of factors. Being outdoors decreases the likelihood by a good amount, but if you're in close proximity to someone for a long period of time, or in close proximity to someone or to a large number of people for a long period of time, that's going to also raise your risk a little bit. So there's going to be some risk to, going to, say, like a state fair, or playing with a lot of children in close proximity. But outdoors is better than indoors. And if people are masked, that will certainly also give you some protection as well and lower the risk.